Okay, well, we'll get started. There'll probably be a few more people still joining for the next minute or two, but I'd like to welcome everyone who's here already to this seminar. It's presented by the Melbourne Social Equity Institute and the Peter McMullin Centre on Statelessness. And if you're not a regular at these seminars, please do join on to one of our mailing lists so that you find out about all of the events that we hold. So before we begin, I'd like to acknowledge the traditional owners of the lands on which all of us are today. I'm on the lands of the Wurundjeri people of the Kulin Nations, and I'd like to pay respects to elders past, present and emerging, and also acknowledge any Indigenous people in the audience today. And I'd like, everyone obviously will be joining us from different lands, so I'd like you to also think about the unceded lands of the people where you are as well. So just to let people know, we'll be using the Q&A function today. So please, if you have any questions for the speakers, we'll be addressing them all at the end. Please do put them in the Q&A box. You can use the chat function as well, but don't put your speaker questions there. Please just use that if you've got any other things you want to share with each other. We'll be recording this session and it will be made available on the Melbourne Social Equity Institute and the Peter McMullin Centre on Statelessness websites next week. Talking about domestic and family violence can be difficult for people, and we know that there will always be people in the audience who've had experiences themselves. So if anyone does need to leave, you can always pick up later with the recording if you want to. So I'll introduce our speakers today. Firstly, we have Associate Professor Cathy Vaughan, who is Co-Director of the Centre for Health Equity in the Melbourne School of Population and Global Health at the University of Melbourne. And she's also the Interim Director of the Melbourne Social Equity Institute. That's a lot of equity in your name, Cathy, in your title. Cathy leads research on preventing and responding to sexual and gender-based violence against migrants and refugees, women with disability and women in faith communities, and a lot of other things besides. And I'd also like to welcome Dr Adele Murdolo, who is the Executive Director of the Multicultural Centre for Women's Health. It's a community-based organisation led by and for migrant and refugee women to advance women's health through education, advocacy and research. Adele has a PhD in History and Women's Studies, and her research and publication areas include women's health, violence against women, and feminist history and activism in Australia. So it's fabulous to have you here today. Okay, so we're going to hold this as a bit of a Q&A and informal session. We won't be having any PowerPoints to make a change since we have two speakers. So Cathy, my first question is to you. You've been conducting violence-related research with migrant and refugee women and with organisations that work with them, including settlement and multicultural services, for some time. Responding to violence against women requires specific skills and training to do so safely. It's a specialist sector. So from your research, what do you think the role of the settlement and multicultural sector is in supporting women experiencing violence?
Thank you, Karen, and thank you to everyone for coming along to the seminar today. Before I respond, Karen, I just will acknowledge that I'm on the lands of the Wurundjeri people and to acknowledge their elders past and present and any First Nations people on the call today, and to acknowledge that in relation to your question about the role of non-specialist organisations in supporting women experiencing violence, that we all have an awful lot to learn from First Nations community-controlled organisations who've been supporting women experiencing violence for a very long time, often in the absence of very much support to do so. So directly in response to your question, Karen, about the role of settlement and multicultural services in responding and supporting women who are experiencing violence, and whether this should be a specialist area, left to the specialist organisations, the first thing I'd say is that the multicultural and settlement sector are doing it anyway. So when, as a Multicultural Centre for Women's Health and our team at the University of Melbourne have worked together for many years now, Adele, doing research around migrant and refugee women's experiences of violence, the help that they can and can't access, and then the organisations who are supporting them. And as part of that, one of the projects that we've done together is the Muses project, which was funded by Australia's National Research Organisation for Women's Safety. And as part of that program, we surveyed 378 settlement and multicultural service providers about their experience of supporting women who, or whether or not that is something that they did as part of their role, encountering and supporting women who are experiencing violence. And 92% of them had, as part of their role in settlement and multicultural services, encountered and either tried to support or been unable to support women who are experiencing violence. So that's the first thing I'd say, that these organisations are regularly encountering, and for many of them it was more than once a month, encountering women who are experiencing violence, receiving disclosures of violence, or particularly for organisations who'd received training, becoming aware of and recognising some of the signs of violence. And there's lots of reasons why settlement and multicultural services are in a position to receive disclosures and to identify signs that women might be experiencing violence. They've often got really strong relationships of trust with migrant and refugee women that have been developed over time. So in contrast to some of the other non-specialist sectors that women encounter in their daily lives, often we were talking with service providers who had been working with the same family for an extended period of time. They may have been in the house providing English language tutoring. They may have been driving people around to appointments and helping them navigate a whole range of services that people need particularly when they first arrive in Australia. And through that process of building different relationships of trust and understanding than other services and sectors may be able to do. So there is certainly a role to support these settlement and multicultural services to do what they're already doing better. So to be trained to do it and to be resourced to do it. So many of these organisations were going sort of what we were describing in our research report, sort of above and beyond. They're funded to support specific aspects of settlement or to provide a range of programs that may have an intention around social cohesion for and community participation and so on for multicultural communities. They're not necessarily funded to do this complex, difficult work and sometimes hadn't had any training in how to do so, and yet are trying to support the community members that they've got these great relationships with to do so. There's real strengths in them doing that. As I said, they've got the relationships of trust often, but they also have cultural and linguistic expertise that many specialist services don't have. And so I think that's another way that they have a really important role to play. And then the final point, I mean, there's lots of points I could make, but I'll make sure Adele's got some time to respond as well, is that the other, I think, real strength of multicultural and settlement services is that they have strong relationships with men, and that the service providers that we receive survey responses from, but also certainly the large number of people that we interviewed and had participate in focus group discussions made it really clear that they're regularly encountering men who use violence as well as women who are experiencing violence, and that in their ability to engage with men is perhaps a strength that the sort of mainstream, for want of a better word, and domestic violence specialist services often don't have, and sort of talk about men as being difficult to engage. Well, here's a sector that have these strong relationships already. So I think there's lots of potential to build on that. And it's a real strength and a potential role that could be expanded with appropriate resourcing and training.
Thanks, Cathy. Yeah, agree with everything that you've said. Adele, you've been working with Cathy and colleagues at university, myself included, since 2013. But in addition to this applied research, the Multicultural Centre for Women's Health are also engaged in building settlement and multicultural organisations' capacity in relation to violence against women. Are there specific challenges that you see that the sector faces and that you can share with us?
Thank you, Karen. And I would also like to acknowledge that I'm on the lands of the Wurundjeri people of the Kulin Nation, and I would like to pay my respects to elders past and present, and to any Aboriginal or Torres Strait Islander people on the call today. Yeah, that's a really good question, Karen, and thanks, Cathy, for that fantastic overview. We have been doing work with Multicultural and Settlement Services for a number of years now. It probably goes back about 4 years, where we started working with them around building their capacity to do both the kinds of things that Cathy was talking about, providing a direct response to women who are experiencing family violence and doing an appropriate referral to a family violence service or other kind of service that they need, whether it's legal or health. And also in the preventing violence against women space, which has been fantastic, actually, because it's much more focused on building gender equity in communities, which I guess it's a much more positive space to work in. But we've run these projects. The first one that we ran was focusing on prevention, but also had an early intervention component because these organisations were taking referrals. And our work was really in just getting them to the point where they're able to both inside their organisation. So it was a process of organisational capacity building that we did with them before they then would go out to their communities to work with them around prevention and early intervention. So it was questions around, you know, what kind of leadership do you have in your organisation? What's the role of migrant women in your organisation? You're a multicultural service. Do you have women in leadership roles? And you know, if not, how can we support you to build opportunities for equal leadership within your organisation? And they then took that learning from within their organisation and started working with communities externally to do that gender equity capacity building as well. So your question was really about the challenges, Karen, and I think, Cathy, you've talked about some of those things in terms of some of the challenges that this work is very either not funded or has limited funding. Another problem to do with funding is that it's often project funding. So it's like you get funded to do 2 years worth of work, you build up these fantastic relationships, you just start to get things going and then that project's finished. So in this space, that's been exactly the case. We had a project, went for 2 years, and then, you know, we weren't able to continue with that. Some other challenges, and I'll just name two. One is that sometimes, you know, we've got some excellent evidence-based frameworks that we use in preventing violence against women in Australia. So Change the Story is obviously the kind of main one. But when we go to use Change the Story, it doesn't adequately account for the intersections between gender inequality and race and other forms of inequality. So we have to do a bit of an adaptation process before we're able to use those frameworks to work with multicultural communities. So that's one challenge. A second challenge is that when it comes to the early intervention work, when there is capacity within a settlement service to work with women and to you know, do very good risk-based assessments and referrals, there isn't always a service that you can refer that woman to, and that's particularly acute within rural areas. So we did hear some stories while we were doing this project work of, you know, one story in particular, a woman who was working with that multicultural service, and this worker who was employed by that service referred that woman onto a family violence service that she didn't meet the criteria for. So she would come back to the settlement service. That settlement service had no further service to offer them because she really needed a family violence service. So she would end up, you know, on a Friday night, again, you know, knocking on the door of this settlement service, locked out of both services really, because the multicultural service couldn't offer anything and she didn't meet the criteria for the family violence service. So yeah, very challenging situation for this lone worker in a settlement service to have to deal with. But until we do have more capacity within mainstream family violence services to be able to provide adequate services to migrant women across the board, we're going to continue to have those kinds of problems.
Thanks, Adele. That's a really awful story about that woman, and unfortunately probably all too common. We've just had a couple of people type into the chat that could we please all speak slowly so that we're not too hard to follow. And Adele, a suggestion that if you could sit a tiny bit further back from your microphone because the sound's distorting somewhat. So a couple of things on sound quality there, and we'll move on. So Cathy, my next question to you, I guess. So in addition to what you and Adele have already covered, are there any other things that have really come out through your research that are particular issues in this space?
Yeah, so in addition to the challenges that Adele raised, which are very real, and certainly all our recommendations coming out of a number of research projects now are addressing the need for funding, training, capacity building, and that be sustained, because that's obviously such a recurrent finding. But there are some specific challenges for supporting multicultural and settlement services to do this kind of work, recognising that they are not a domestic violence or family violence specialist agency and shouldn't be expected to take up that role, but that they've built up these relationships with families. They do step into that role because there's a woman in front of them who needs that support. It's very hard for multicultural and settlement services to support some women who, with the eligibility criteria in terms of that Adele raised, which may be around length of time in Australia, it may be around visa status. So often women who've come through the humanitarian pathway who are dealing with settlement services, it's clearer their entitlements and so on than for women who are on temporary visas who don't have access to settlement services but may be engaging with ethno-specific multicultural services, how to get them support when there are constraints on the kind of survival services that they would need to leave a man who's using violence against them, for example. There are challenges arising from a bit of a historic lack of trust between the sectors, and it's partly around the constraints on both areas and not necessarily understanding each other's constraints. And so that issue that Adele raised of someone being referred to a service, they're not meeting the criteria, they get sent back. And so that both sectors can wonder what the other sector is doing. And many settlement and multicultural services also have big volunteer workforces there, and their paid salaried staff are also from migrant refugee backgrounds themselves, and sometimes can have fairly conservative attitudes around gender equality, as can non-migrants, of course. So just thinking about the week that's been with the Women's Safety Summit. But that can also lead to sometimes specialist services seeing things where women are getting poor advice, being counselled to stay with her husband, not to bring shame on a family, a range of things that may increase the mistrust between the services. That big volunteer big volunteer workforce who are extraordinary and do incredible work and who are such an asset of the multicultural and settlement sector are also a challenge, because in our research we found they're the group who haven't been trained. The management have been trained. Many but not all frontline workers have been trained, but certainly the volunteers who do the English language tutoring, who do the support for the mums groups or the women's groups, have had very little training around recognising and responding to signs of violence. And then the final point I'd make, just give me one chance, is that there are particular challenges for multicultural and settlement services in dealing with backlash and resistance, particularly when they're working in the prevention area. And prevention involves addressing, encouraging gender equality, which, as Adele said, is a really positive area to be working with, but can mean that you run into people who resist change to the status quo. And if those organisations haven't been supported in how they anticipate and prepare for and then respond to backlash and resistance, it can leave the workers very vulnerable. And that was certainly something that came through the qualitative component of the Muses project.
Yes, I've seen. Yeah, we've seen that in several projects. I think it's and so I guess building on that really around the research that's being done and what's coming through the research. We have seen governments in recent years, particularly the Victorian government, invest dedicated resources to strengthen the ability of multicultural and settlement services to play their part in preventing and responding to violence against women and family violence. Adele, have you seen much evidence in your practice that the research that has been done and the findings from that research is being applied in practice?
Yes, and you're absolutely right, Karen. There are some governments that have been investing in this work, in funding multicultural and settlement services to take a more, I guess, a more trained and coordinated approach to responding to women who come to them who've experienced violence. I know of projects that are taking place in New South Wales as well as Queensland. In Victoria, there are a number of fantastic projects that have just even recently been funded. There were 33 projects that were funded to work in the multicultural family violence area, in both prevention and in early intervention. And these organisations, they will be coming together in a community of practice. It has only just recently happened, but the plan is that once all the projects get going, there will be an opportunity for them to come together in a community of practice, which means that they get an opportunity to kind of learn a bit more about preventing violence against women and providing a early intervention response. They can share what they're learning in their different organisations. So you might have, Indian organisation and a, Vietnamese organisation, and probably, finding different issues and same issues in their communities when they're working with them. And they get an opportunity coming together in this community of practice to really share what's going on and how they can move the work forward as well. So one of the things that I can share from a previous community of practice that we ran was the issue that kept coming up for practitioners were myths about culture. So people were still saying things like, oh, well, people in that community, the men are much more prone to violence, or they're much less supportive of gender equality. And so this would come up a lot of the time, and it would be very difficult for people for the practitioners to respond to that, especially when those same stereotypes come from within the community. I think if they come from externally, it's a little bit easier to say, well, you're just looking at our culture in a way that doesn't understand us. But when it comes from inside the community, and sometimes it does, because that's based on people's experience, it's a fair thing to think when that's been your experience. But there's also a real need to question and challenge how people's experiences also sometimes can link to stereotypes. So this was coming through one of the community of practices that we were working in. And so we developed a resource called Challenging Myths. And that was really kind of spelling out what some of the myths are, and then presenting some suggestions for how people can respond to those myths when they hear them. So I think it's really powerful for people to come together and share what they're experiencing, especially when it's a shared experience, and then together developing strategies to be able to deal with those. So I think it really helps move that work forward. Karen, you're on.
I've been talking on mute, yes. Thank you. Yeah, I was going to say how fabulous the resources that you've produced are. I look at them and use them often. So Adele, I'm actually going to ask you another question. I know this is a very timely talk in many ways, because this week the federal government held the Women's Safety Summit to inform development of the new national plan to end violence against women and children. I'd ask you to comment on what you think needs to be included in the plan based on the research evidence we've been talking about today.
Sure, thanks, Karen. It was a real roller coaster of an event, I must say. There were some amazing panels. I'm not sure how many people got to see them, but the Aboriginal and Torres Strait Islander panel was brilliant, and the panel on sexual violence that included advocates from the sector and Grace Tame and others who were brilliant people with lived experience. So that was all great. On the downside, there was a very limited representation of migrant and refugee women as speakers. I think there were like 2. And also the issues didn't come up very much. Having said that, the summit has released a statement, and that does include some quite good comments relating to diversity and equality. So I think that's well worth taking a look at. At the same time, there were 9 migrant and refugee women's organisations that came together before the summit, MCWH included, and we drafted a joint statement. And in that, I think we came up with a number of recommendations for what needs to be in the national plan. So including in relation to prevention, to make sure that prevention is community-led, that there's leadership of women in community-led prevention projects, and that there is a level of national coordination of that, so that we don't have, kind of lots of work going off in different directions and not sharing, as I mentioned, in that way with communities of practice. So we really want the work that's happening nationwide to have that opportunity to come in centrally and share what's going on and share strategies as well. In terms of research, actually, I'll first say about response. The other thing that was really important that needs to be in the national plan is thinking about how the systemic barriers and the systemic the systems that generate inequality. So for migrant women in particular, that's clearly migration policy. So how things like temporary visa systems and even the 2-year waiting period that there is for migrants, even if you're not on a temporary visa, if you're on a permanent visa, there's a 2-year waiting period before you have access to any government support, which of course just makes you very dependent on others, dependent on your partner, dependent on your families. So that's just really something that if you have women who are financially dependent on others, that's not an equal situation, and that's a situation that generates violence against women. So finally, on the research and data collection front, we recommend in our joint statement that there is a robust data collection and monitoring framework that's developed for the national plan, and that not only collects data about experiences of violence and programs that are out there as well, but that it gives us a sense of country of birth, it gives us a sense of ethnicity, so that we're able to properly understand, which women are having access to services, who's missing out, and that kind of thing, so that we can then obviously evaluate at each 3-year period of the action plans for the national plan, is this working for the more marginalised women in our community? So there's that. And finally, we recommend that there be a robust research program that focuses on a better understanding migrant and refugee women's experiences of violence across a whole range of topics. So it's not enough to just have, one project amongst a number that are done in one round. We really need to know that there's a lot of research projects that, whether they're looking at health system screening or whether they're looking at perpetrators, we need to make sure we've got the diversity of issues represented across those research programs as well.
Yeah, thanks, Adele. That's so important, and I'm glad you've put in a wish list. Let's hope that it all comes true. And so we'll move to questions very shortly, but Cathy, just before we do, is there anything you wanted to add in terms of the types of research gaps that we still have and what things you think we need to still be looking at?
Yeah, well, there's a lot of research gaps still. I think, you know, the points that Adele's made and that the sector's really arguing for are fantastic. And I think encouraging everyone to look at the statement that came after the summit. The best thing about the summit, perhaps, I mean, there were some absolute standout panels, but I think the statement has managed to bring things in that were perhaps invisible in the actual 2 days. I think for me, some research priorities in relation to the settlement and multicultural sector. One of them is around men. And so I think the degree of engagement that settlement and multicultural organisations have with men is, I think, a real strength and a fairly unique strength, and therefore how to capitalise that in initiatives to prevent and in early intervention initiatives in response to violence against women. But having a really robust research program around that to try and understand what works for whom and what are the conditions that are required for it to work. That is probably quite aligned with another research priority, I think, is around the role of the settlement and multicultural sector in prevention, is to try and understand what it takes for it to work. So we have lots of case examples, even Karen, from the work that you've done evaluating the wider package of prevention work that was funded by the Department of Premier and Cabinet some years ago. There's lots of fantastic examples, and I'm sure many people on the call are doing brilliant work in communities, but what we often don't have is the kind of process evaluation around, and I know that was a big part of your focus, Karen, is to really try and pull together what are the effective preconditions for this work. Is it about support from the management level of your organisation? Is it about having women in leadership? Is it about how you engage men in the community? Is it about things like dealing with intergenerational conflict that can arise around discussions and conversation and work around gender inequality? Because as Adele, you were saying that sometimes the stereotypes, you know, are within, as well as white community members working with migrant refugee communities. It's sometimes trickier within communities to have these really difficult conversations, and they are not always, but they can definitely be across generations. And so how do you do this work that doesn't create community conflict, but that supports, that gets in behind the people who are already doing this work, and they know their communities, they know where things need to change. You know, what needs to be done to support organisations in anticipating backlash and resistance, and how do we better support them to respond to that? And I guess my final two research final points, sorry, I've always got an extra one. One is around recognising the diversity within migrant and refugee communities. So there's tendency to lump all people from, you know, the entirely enormous country of India together as one thing is just outrageous. So the incredible diversity within migrant and refugee communities needs to be accounted for in research in ways that can inform programs that can reach all. And the other key point I'd make is that, as well as research around kind of specialist interventions and programs, is how do we ensure that, exactly as you say, Adele, we've got the data on all programs, so that research programs working in the health sector, working in schools, working with sporting clubs, that they are able to understand about whether their initiatives work for whom in the wider public that they're working with. Because at the moment it's often seen as, oh, this is just the job of the migrant and refugee sector, it's just the job of, you know, brown and black people, rather than this is actually all of our work, because this is the Australian community, and so we need to engage with everyone in this work and this research. So I'll pause.
Thanks, Cathy and Adele. We will move to questions now, but I think, yeah, there's so many great points to build on there, and we could obviously talk about this for a lot longer. I'll just remind people, please do put your questions in the Q&A box, not in the chat, because that's where we'll be taking questions from. So I'll just start with the second question that came up, because it's a very definitional one, a very foundational one, really, asking how do you define violence? Are we talking about domestic violence or other types of violence? So, you know, I guess defining our terms here.
Yeah, so thank you, Tahira. This, for the purposes of the Muses project, which was I mean, we're mashing together findings from a number of research projects here, but for the purposes of the Muses project, where we were looking at services supporting women experiencing violence, in that we were including women experiencing or who had experienced family violence, but also sexual and gender-based violence that may not have been family members. Of course, we recognise that violence is a continuum and that women experience structural violence and state-sponsored violence and symbolic violence and a whole range of forms of violences. But I think what we were, for the purposes of trying to think about the role of settlement and multicultural services, who often have lots of expertise in structural and state-sanctioned violence and the trauma that their clients and the communities they work with have experienced, but where they may have less experience and expertise was in this interpersonal family violence and sexual and gender-based violence.
Thanks, Cathy. And the next question, which you started to touch on actually in your previous response, was, does the research cover the regular training of mainstream services and their cultural responsiveness? As more often than not, if it's a called person or a culturally linguistically diverse person, then there's an instant referral made to a settlement service when this doesn't need to be the case. So the lack of experience of having a culturally appropriate lens, I guess, within mainstream services can also hinder engagement. And yeah, would either of you like to comment on that? Because I know this comes up.
So maybe if I can just respond from the point of view of the Muses project and then hand to Adele, because I know you'll have things to say here. So in the Muses project specifically, we were really working with settlement and multicultural services, so we weren't so much engaging in the wider, and that included specialist refugee mental health services, for example, but we weren't engaging in the wider family violence or domestic violence specialist service. Previous research that we had done, which Muses emerged out of, did engage with the specialist family violence and domestic violence specialist services. That was the Aspire project, and the reports for that project are also available, because that was also funded by the Australian National Research Organisation for Women's Safety, so that they're also available on the ANRO's website. Very clearly found, Nellie, that you're absolutely right, that when a woman of a migrant and refugee background came to a specialist service, they were often either instantly shown to the one migrant or refugee background woman who worked in the organisation, because clearly she's the only person in the organisation who could support them, or was sent elsewhere. And I think what we were really getting to at the end of the Aspire project was emphasising the need for choice and for women to be able to choose to go to a specialist family violence service that worked mainly with migrant and refugee women, or to choose to go to their local service that should be able to cater for everyone who walks through the door, or to build on the relationships of trust that they might have established with other organisations, though recognising they're not specialist violence providers. But to have that choice, that we need these mainstream organisations to be able to work with all women. But I'll hand over to Adele here, because this is something that's a very big part of your advocacy.
Yeah, definitely, Cathy. Look, yeah, I think that there's so much work that needs to be done in mainstream family violence services to both think about how bicultural, bilingual workers can be incorporated into that system, but also to think about the leadership of the services themselves. So like a lot of community services in Australia, they're dominated by, I guess, Anglo-Australian people. So we don't see a lot of leadership from the migrant community within the organisations themselves. So we do see some involvement, but they're generally speaking frontline workers that are working directly with the community. But when we look in the leadership, we're really not seeing the community adequately represented in an equitable way. So I think there are lots of different levels where we need to really kind of boost the capacity of family violence services to be able to then, kind of start off with the leadership, the governance, and look at policies, procedures, and then the way that you work with communities in an equitable way. And it really has to be an organisation-wide and, in fact, a sector-wide initiative that will get us to the point where any migrant woman can use a service and it provides her with the service that she needs in a culturally appropriate way, with a worker who speaks her language, and a response that works for her. So I think it's a lot of work to be done. Unfortunately, the family violence reform in Victoria didn't necessarily focus enough on building equity into, say, the orange doors, the hubs, and so we're not really where we need to be there. I think they have an opportunity now to focus a little more on how they can embed equity into their service delivery and service delivery practices, and also organisational systems.
Thanks, Adele. And of course, that cuts across all sorts of services, not just violence.
Exactly. Yes, absolutely. Yeah.
Okay, there's a question here from Mandy, and it's a little bit related to what we were talking about around backlash, but a bit different as well. So is there work directly looking at addressing stigma around discussing domestic and family violence? Some people in communities don't want to even have a conversation about it. And that's either of you.
I don't know of any research on that. There could be, and it is a part of the work that we're doing peripherally, but I think, Mandy, that would be fantastic to do some more research in that area. I think stigma generally in Australia, like on a whole range of issues, I don't think we have a big focus on it. There is, a lot of other organisations, I know they address stigma much more front on, and I think it's an important aspect of the work. So I'd love to see more done in that space.
Yeah, I would add to that there's not enough work around stigma, and the work perhaps I'm most familiar with has been in very specific migrant and refugee communities, and not just and it's in communities of faith. And Mandy, I know that's an area that you also have a lot of experience in, but certainly in our work with faith communities, where there can be a real reluctance to talk about violence because it's seen as, we're peaceful people, we're gentle people, we're forgiving people. This is not something that happens in our community. There can be an absolute silencing of women who are trying to disclose or raise issues of violence. There can also be tension around a lack of willingness to have the conversation, because it opens up all communities are highly diverse, and we sort of can really reify communities as these lovely groups of people that are supporting each other, and that's absolutely true that communities do that, but they're also contested places and places of division and power plays and sort of all sorts of things going on under the surface in all communities. And so by having conversations that challenge different groups, sometimes communities can be not willing to go there because they're dealing with a lot of other stuff. So certainly in Aspire, we found that communities were dealing with racism, they were dealing with this sort of exclusion of their young people from schools. They didn't want people talking about family violence because they were trying to present the community in a certain light to the wider public, and they felt that shame and stigma that you're talking about, Mandy, would undermine the kind of way they were wanting to present the community. Similarly, in faith traditions, sometimes talking about gender equality can open up division within what are often very broad churches, for pardon the pun, and can be seen as undermining cohesion within the community, and across these very different understandings of teachings and so on. So it's a huge question, Mandy. I think it's something that definitely needs to be more work on, and dedicated work, both for survivors, but also in the prevention space.
Thanks, Cathy. Now we've run out of time, I'm afraid, for more questions. So we will need to finish up there, but please, feel free to get in touch with us if you want to continue some of these conversations. So I'd like to really thank Cathy and Adele for all your insights. We could do this for many more hours. I think there's plenty more to say. But I would refer you to the reports which are available through ANROS that we mentioned. Also, I just wanted to let people know that the next event in our seminar series will be at 1 p.m. on Thursday, the 7th of October. And just to note that that is daylight saving will have started in Victoria then. So if you're listening in from another state, do check the times carefully. And I noticed that Claire's just put the link up in the chat, but the speaker will be Dr. Katomi Gatwiri from Southern Cross University. Katomi is a senior social work lecturer at the Faculty of Health at Southern Cross, and her award-winning disciplinary research investigates topics of racial trauma, belonging, Blackness and Africanness in Australia. And her seminar is entitled Perpetual Strangerhood, Experiences of Highly Skilled African Professionals in Australia, and sounds fascinating. I'm very much looking forward to it. So we will stop there. Thank you very much. It's been a really great discussion. I'd like to thank both our speakers.